Hello, my name is Michael David and I am a Clinical Research Fellow at the Dementia Research Institute at Imperial College London. I'm going to be talking to you about our new paper in jnnp titled Cognitive and Neuropsychiatric Effects of Noradrenergic Treatment in Alzheimer's Disease, Systematic Review and Meta-Analysis. First, I would like to provide some background. In this meta-analysis, we assess the evidence for the extent to which noradrenergic agents show therapeutic benefit on cognitive and behavioural aspects of Alzheimer's disease. The rationale for this study was based on the fact that there is early dysfunction to the locus coeruleus noradrenergic system in Alzheimer's. This leads to cognitive and neuropsychiatric symptoms in some patients. This schematic shows the presumed site of action of the noradrenergic drugs included in our meta-analysis across 3 receptor subtypes. Green labels represent receptor stimulation and red inhibition. We systematically searched Medline, Embase and clinicaltrials.gov databases from 1980 to December 2021. Our initial search produced 2,778 papers, and of these, a total of 19 Alzheimer's/mild cognitive impairment studies were eligible for inclusion. Our outcome measures were global cognition and cognitive subdomains, as well as behavioural symptoms. As different outcome measures were used across papers, we calculated the standardized mean differences. We performed separate meta-regressions to define whether covariates had an effect on results. Our meta-analysis of global cognition included 10 studies and a total of 1,300 patients, and showed a small but significant positive effect of noradrenergic drugs, as you can see from this forest plot. In terms of cognitive subdomains, a small significant effect was also seen in our analysis of the effect of drugs on semantic memory. However, contrary to our prediction, no significant effect was seen on measures of attention. The largest and most significantly positive effect was seen in the apathy subdomain of behavioural symptoms, and the result remained significant after removal of the outlier seen below. We then performed a meta-regression which showed that none of the covariates included were significantly associated with effect size for global cognition or apathy. Discussion. The results of our meta-analysis show that drug repurposing with established noradrenergic drugs is most likely to offer effective treatment in Alzheimer's for general cognition and apathy. Several factors should be considered before designing the future trials which are required to further confirm these results. As cognitive performance is proposed to be optimal at an intermediate level of noradrenergic tone, as per the Yerkes-Dodson arousal curve, trials should consider targeting appropriate patient subgroups with particular noradrenergic dysfunction and symptom profile. What's more, stimulation or inhibition may be helpful at different stages of illness and for different cognitive or behavioural domains. The dose effect of individual drugs and their interactions with other treatments to minimise risk and maximise therapeutic effects is also yet to be fully understood. Finally, what we hope you take away from this study is that there is good evidence that noradrenergic drugs could be effective in treating cognitive symptoms and apathy in Alzheimer's disease. We believe there is a strong rationale for further targeted clinical trials in this area. Thank you for watching, and please feel free to get in touch.